Hello, Dr. Hadar. It's nice to see you. My name is Tamara Ekus. I am the president of the Reflections of Grace Foundation and also the vice president of the DIPG DMG Collaborative. We are asking you here today to talk about your project. Very exciting. But first, we would like to tell you that we have decided to award you a $200,000 grant for your project titled Targeted and Tuned Dual Targeting and CAR T with Focused Ultrasound. So
Thank
we're proud,
you. Thank you. Thank you so much.
we're so proud to have you join us. And I'm also joined by some others today who would love to congratulate you. So I will pass it off to Jill.
Hi, I am Jill Walworth, and I'm the director of the Indiana um, Courage for Conley chapter of the Cure Starts Now. I'm here today on what would be my daughter's 19th birthday to honor Conley by supporting your research for a cure from the disease that took her from us. So, on that note, I'm going to pass it on to Jim.
Dr. Hadar, I'm Jim Getchy with The Cure Starts Now, and I know I speak on behalf of all of us how proud we are and thrilled to award this grant to you and watch you succeed with all of your efforts with you and your entire team. And with us also is Jackie.
Hi, Dr. Hadar. Glad you can be here. I'm Jackie Criswell. I'm with The Cure Starts Now, but more importantly, I am the proud aunt to Elena, who's also a DIPG angel. So your work, just like Jill said, is extra important to us all. So congratulations on this grant and thank you for your incredible work. And I'd like to introduce Rachel.
Hi, Dr. Hadar. My name is Rachel, and I'm the Research Support Coordinator at the Cure Starts Now. Congratulations on your grant. We're so excited to see the results and to see where the research leads. And with that, I will pass it to Keith.
Congratulations, Dr. Hadar. I'm Keith. I'm with Cure Starts Now, obviously a parent. It's always great to start these off by saying, congratulations, you won an award. So,
Thank you so much. I really appreciate it. It's very humbling and also honoring to be able to partner with you and to be able to have your support to do this work. I do work for each and every name that was mentioned today. Happy birthday to the 19th birthday would have been. And I really want to try to make an impact and change this trajectory so that they can still celebrate their birthdays with us as long as possible, but also without the side effects of the devastating medications that we have right now.
well, agreed. And looking at your project, one of the things that we always have high on our list is to focus on those combination therapies. And with this, I think you did exactly that by focusing on CAR T and then a little bit of focused ultrasound as well. Can you talk to us a little bit about what you hope to see by the combination of these two strategies together in your grant?
Absolutely. So basically, the grant is two parts. The first part is really to try to optimize the targeting with the CAR, and I'll explain in a second what a CAR is, just in case, and focused ultrasound. So what the CAR is, or the CAR T-cell immunotherapy is, it's a kind of bone marrow transplant that we usually do for kids who have blood cancer, but it's very specific in a way that we engineer those immune cells that we take from the kid in the lab in order to see the cancer and only attack the cancer cell. So why we're excited about this immunotherapy is that in contrast to radiation or chemotherapy, which destroy any rapidly dividing cell, they can see and recognize the cancer cell and hopefully only kill the cancer cell. So that is why it's safe. And then they are effective because they can use the immune system, which is our natural defense mechanism to fight flu and COVID and any kind of infection. And that's why they are powerful. Unfortunately, in brain cancer and in DMG, the CAR T cells have been safe, luckily, but they haven't been effective. So the first strategy that we're trying to use is to try to develop a dual CAR, which is against two antigens, one that has already been in the clinic, it has already been shown safe. It's in a clinical trial at St. Jude where I trained and in Seattle. And right now, we're trying to add an additional target that not only directs those T cells to the tumor, but also to the suppressive immune cells that prevent them from being fully activated. So that's the first strategy. And the second one is to try to combine it with focused ultrasound. And what focused ultrasound is, it's similar to the ultrasound that a pregnant woman does to see if there is a baby and the health of a baby, but it's a very focused to the specific region of the brain, and that's why it's safe. We only target the tumor and where it is in each patient, and it uses higher intensity sound waves, and what it does, it disrupts the blood-brain barrier and also the tumor. So it makes the T cell able to travel into the core of the tumor. And what we've learned from other trials in Seattle and St. Jude is even when you deliver the T cells into the brain, the T cells are not able to get to the core of the tumor, or when the tumor is diffused, they get very weak and then they get inactivated. So we're hoping that the focused ultrasound would also help create inflammation, sterile inflammation, that would keep those T cells active and able to fight for a longer time.
Well, and this is really the next step in some other research that we've also been supportive of, both in the focused ultrasound realm through a couple of grants, and then through various CAR T strategies, very specific to what you talk about in Seattle. So, it's nice to see these come together, and I think that's the reason why it was a really good fit for it. So, well, we appreciate you t telling us a little bit about the grant. We're excited to learn more about it, and certainly wish you the best of luck with this project.
Well, thank you so much. I'm very humbled and very honored to be doing this. And I can tell you a secret that we've been working in the background with the limited resources that we have, and we have very promising results on the combination. And we're really hoping that in the next year or so, we can move it into the clinic. And you might already know that at Children's, we are one of the very few institutions, you can count them on one hand, that have a focused ultrasound and have done focused ultrasound in DMG kids. So we're really on the right path, and thank you so much for your investment.